Chris and one of the Bondi Clinic interns, Ali, are answering an SOS after devastating bushfires on the outskirts of Sydney.
Hi, how are you?
Hi.
I'm Chris, how are you?
Nice to meet you.
Nice to meet you. This is Ali.
Hi, nice to meet you.
Now, where's the alpaca?
Through here.
Through here? Oh, so this is in here.
Yeah, this is little Jersey.
Hey, little guy.
And his mum fine.
He looks exhausted, doesn't he?
Yeah, poor little fella.
The tiny alpaca is just 3 days old.
So these guys were evacuated from the fire zone?
Yep. I was hoping it would all be okay, but unfortunately not.
I mean, they don't react to stress very well, do they?
No, no. Our farm is under threat of bushfires. The fire line is only 6 kilometres away from us, so I made the decision that we had to get the animals off.
Fine was lucky that Debbie managed to get her out of that bushfire zone in time, but in the stress of being shipped out of there, it's brought on the early delivery of her little baby. And now Jersey is fighting for his life. He's just been lying around like this, has he?
Yeah, he tries to sit up sometimes and then he's exhausted again.
Yeah.
When Jersey first came out, he was limp. Normally within an hour they're up and feeding and they're fine, and he wasn't moving. He was laying there shivering.
Certainly when they're premature, they're not as fully developed, but even so, for him to be this weak and just to be lacking energy like this, I'm just a bit worried there might be something else going on with him. You look at little Jersey and he looks barely alive. Now, even though he wasn't burnt by the bushfires, they could still cost him his life.
I'm actually heading out to the South Penrith Veterinary Clinic. So they've got a lot of injured animals that have been dropped off at them with burns and smoke inhalation.
SASH emergency vet Lisa Chimes has been called to a clinic near the fire zone.
Hello.
Hi Lisa, great that you could come.
Thank you.
We're inundated with bushfire victims.
Dr. Robert Johnson has been working non-stop since the fires passed.
Over here we've got possums, and we've got more ringtails than I thought we'd get, because I think they've all been displaced from their habitat. They're normally shy and secretive animals.
Oh, goodness. So who's in here?
So this is Patricia, so she's a little female brush-tail possum.
Patricia is suffering deep burns to her ears, face and feet.
Those burns look pretty nasty, and I think if we don't get onto them quickly, they're going to get infected, and it's not going to be good news for her at all. So at the moment what we're doing is we're giving Patricia an anaesthetic, and the reason for that is because she's a wild animal. She's not used to being handled by people. She's got really nasty burns on her ears, almost 3rd-degree burns. We've really got to treat these quickly, otherwise she's not going to survive this.
Back in Sydney, Crystal and her mother Rosemary have rushed 2.5-year-old Misty to the Bondi Referral Hospital, SASH.
But I mean, what I worry about is if they say we have to keep her still. How?
The Labrador has lost all movement in her hind legs.
How you going? I'm Andrew.
Specialist surgeon Andrew Marchevsky needs to urgently assess the Labrador.
Hey, sweet. What's up?
What's up?
You're a good girl. You're very calm.
She is. She's a big doll.
Yeah, you're beautiful. No, I just walked in the room and it's pretty obvious that Misty's paralysed. She's not moving those back legs at all. What happened?
She was going at speed. She was running up to get the cat's dinner and I think overreached.
Oh, okay.
And so I think she probably flew down the steps.
And she was like that immediately?
She was obviously in pain and shocked, and she pulled herself in from the gate with her front legs.
Okay, yeah. I mean, typical Labrador, she spied some food and gone off after it, but forgotten that there's a 1.5 metre drop in between, and she's just fallen off it, landed on her back, and then suddenly she can't use her legs. It's not good. Have you seen it with any movement in these back legs?
Not since this happened, no.
First thing I'm going to check is, can she feel her feet? Because if she's got no sensation in her feet, it's pretty much all over. She won't walk again.
Yeah, obviously the stress explains why Mum has done what she's done, and being taken out of her home environment, trucked down here, obviously has a big impact. Now, her problem has become her baby's problem. Yeah. And I guess that's what we need to address here.
Chris and Bondi Clinic intern Ali have been called out to help Jersey. The 3-day-old Alpaca has barely moved since birth. His mother was stressed into a premature labour by the bushfire evacuation.
The first thing I noticed is just how incredibly weak this little guy is. He's having trouble even raising his head. He really should be bouncing around, and he, importantly, should be feeding as well. He's doing neither of those.
Temperature's 38.3.
Okay. I just want to check his light reflexes, just in his eye. That's where mobile phones can be very handy.
Yeah.
So I'm checking two things. First of all, just to see if he has some response to that bright light, but also just to see if he's got any flicking in that eye. So if his eyes are flickering back and forth, then it can indicate that he's got some sort of brain dysfunction at the moment. Okay. They're relatively stable there. He just shouldn't collapse like that.
Yeah.
She's burnt the tip of her tail as well. Poor little thing, huh?
At the South Penrith Veterinary Clinic, Lisa's dealing with a badly burnt possum.
I'm just looking at Patricia's feet and just imagining that she was probably walking on a tree that was on fire. She's burnt the tips of her ears, she's burnt her face.
Can you see that, Lisa?
Oh,
look, those little curly whiskers.
Burnt her whiskers.
Yeah.
It's just so upsetting to see burns on our wildlife. It has got to be agony. If these don't heal, Patricia's got no chance. What we're doing now is we're applying some really good antibiotic cream, and we're hopefully going to stop any infection from setting up. It's early days. I don't know if we're ever going to be able to get Patricia to a point where she can be released, but all we can do is try. She'll wake up soon, hopefully. Yeah, honey.
But Patricia is not responding.
Hey, honey, wake up. She's survived a raging bushfire. She's come out with these burns. We just cannot lose her now.
Have you seen it with any movement in these back legs?
Not since this happened, no.
At Sash, Labrador Misty has been brought in following a heavy fall on her back.
First thing I'm going to check is, can she feel her feet? Because if she's got no sensation in her feet, it's pretty much all over. She won't walk again.
You can feel it. I know, I'm breathing in. I know.
Yeah, because her front legs are working, the problem's in the middle of her back somewhere. I don't know what that is yet.
There's three main things I think it could be. One of them, obviously, is she's got a broken back. She could have slipped disc, so she's disc has just ruptured and gone up and compressed the spinal cord. And I guess the other thing is possible is that she's had a spinal stroke. But what we have to do is find out what is going on, and I think the best way for us to do that now is to do a CT scan and have a look at that. And we'll soon tell you if she's got a broken back.
Okay. Obviously, I hope that we don't have to put her down. Yeah.
The quicker we can do something, the better her chances of walking again. And if we delay this, we might get to a point where we can do no good for her. So we've got to do this now.
You ready?
Yeah.
There he is, mate. He's looking at you.
At the Australian Reptile Park, Operations Manager Tim Faulkner and Keeper Kyle have entered the danger zone.
He's going to come straight up.
The pair need to examine Elvis. They're worried the monster croc may have injured his foot.
You all right?
So I was out here this morning, Tim, and he just wasn't acting like himself. He just seems really sooky. He was sitting on the bottom of the pool, just not being Elvis, where he's explosive.
Chasing you out of the yard.
Yeah, pretty much.
One of the keepers last week photographed Elvis with a nail that was torn off or falling off. Mightn't sound bad, but with a croc, that goes right back into the bone. My aim now is to get him out, have a look at that toe, and just see if that's what the problem is. Come on, El.
But luring this 5-metre killing machine out of the water is a dangerous mission.
Elvis is scary. He was captured in Darwin Harbour for attacking fishing boats. He then went to a croc farm where he ate his girlfriends. Not only is he a killer, but he is world famous. He ate, or, well, he killed a lawnmower. Took it in the pool and guarded it like he killed another male croc. You right? Yep. Come back a little. If you go within Elvis's strike zone, he is going to grab you.
On the outskirts of Sydney, Chris is looking for clues as to why Prem baby Jersey is fighting for his life.
He just shouldn't collapse like that.
Yeah.
Nothing truly explains why Jersey is so flat. Then all of a sudden, Debbie tells me something that may unlock this whole mystery.
After she had Bub, I noticed her legs had a lot of blood on it, which is quite unusual. They're normally clean.
It's interesting. Having the blood on the back of her legs isn't a normal thing.
No.
It's possible that because she was under stress, the umbilical cord hasn't torn correctly, and he actually may have lost a lot of blood at that time. Now, if he's lost a lot of blood, I mean, how does an animal that's anemic behave? Exactly like him.
Yeah,
very weak, very floppy, very tired. And without that blood, he's also at risk of infections and also at risk of developing other problems as well. Knowing now that Jersey's birth was accompanied with a lot of blood makes me worried that he's anemic. He needs one thing, that's blood transfusion. So we need a very, very generous alpaca. You know any around here?
Oh, definitely. I can pick you one.
Okay.
Chris has come to the aid of 3-day-old Jersey. The little alpaca is clinging to life after being born prematurely during a bushfire evacuation.
My hunch with Jersey really revolves around two things. First of all, he's anemic and he's lost some blood during the act of being born. But secondly, he's missing some antibodies. Really, the perfect medicine for Jersey right now is blood transfusion.
But first, Chris has to catch a willing donor.
All right, now which one's Boston?
He's over there.
He's the taller one in the middle there?
Yep, arms up.
There we go, good man. A very important job to do. All right, buddy, let's go. Even though Boston is a very calm alpaca, he still may not take too kindly to me taking about 200 mils of blood out of his jugular vein.
Good man.
All right, now when I touch there, I can see the jugular moving up and down. So we're in the right spot. Little burp, Boston.
No, he's about to spit at you.
Is he? That's what you want to hear.
That noise was.
He's just getting one armed and ready. Fair enough, I'd be doing the same thing.
So you can see it's already running quite nicely there.
Beautiful.
I may be trying to sweet talk you right now, but what you are doing is very generous and very kind, and it's going to make a big difference to a young alpaca's life. So I appreciate it, and I'd also appreciate it if you didn't spit on me once we're done. How's that? All right. So that's a good amount of blood there. Thanks, Boston. Thank you, buddy.
Thank you.
My hope with this blood transfusion is really two things. First of all, it'll mean more red blood cells in his system and therefore more energy. But secondly, he's getting a big hit of antibodies. Both of those things combined should really perk him up.
There we go, mate. Very brave.
Seeing how weak he is, the fact is this blood transfusion has to have an effect soon. Otherwise, our little mate's in big trouble.
Hey, honey, wake up. And she's definitely taking a long time to wake up from this. In a healthy possum, I'm used to them bouncing off the walls as soon as we take that mask off.
Patricia, the badly burnt possum, isn't recovering from an anaesthetic, and Lisa is worried.
It makes me concerned that she's actually got some smoke inhalation in her lungs, and that's what's causing this slow wake up. I really, really hope she comes out of this quickly. Pop her into a nice warm bed and hopefully she wakes up quickly.
Oh, sweetie. Good girl. Patricia.
Thankfully, she started moving. She started waking up, so big sigh of relief from all of us, I think. Now we just got to wait and keep treating these burns and hope like hell that they get better. We could give her some food while she's having a little
Food
lick.
now to distract her.
I want something to eat. Oh. Patricia's feeding really well. She's tucking into this pureed apple, and it makes me think that she's got a fighting chance. Oh, you're a good girl.
With the Penrith surgery full, Lisa decides to take the recovering possum to the Bondi clinic.
Come on, Patricia, let's go.
I think what needs to happen is a bit of food. Let's bring him up and see what his attitude's like.
Elvis is one cranky croc with a sore toe.
Come on, mate.
Tim wants a closer look to assess the injury.
Come on. Up, pal. Come on, pal. Up, please. Okay, now he's not putting a lot of weight on that back foot, mate.
I can see that.
You can see it's sore. I mean, there's no nail on there, so the nail's gone. When a nail comes off, crocodile, it's just like a person. You imagine your whole nail being ripped off. Very tender, very sore. So now, on that toe, we've got a white bulbous piece of raw nerve with a bit of tissue around it just sitting there. That's a perfect place for an infection to set in. And on a croc, that's a big problem.
Tim is justifiably worried.
This has happened once before. And last time his toe swelled up like a big sausage roll. It was horrible. I can't let it get infected again. I got to deal with it now.
And the plan is to give him an injection, a broad-spectrum antibiotic. The problem is that crocs are no different than people, and he is not going to like this one bit.
At SASH, 2.5-year-old Misty is being anaesthetised for a CT scan. The labrador has lost all movement in her back legs after a freak accident at home.
Given the fact that she's fallen off a wall, she might have broken her back. So we're really looking at what's going on, and then we can decide what to do. Towards the tail, there's an area here that just doesn't look right, and it looks like it might be a bit of a disc bulging. So there's no obvious broken back, which is terrific, because that's a much harder road to recovery. But she has got a little area there that I'm worried about, that it might be a slipped disc, but it's not clear enough. So we're just going to inject a dye in and around the spinal cord, just to highlight that and see if we can see how bad the compression is, if there is any. We're injecting the dye around the spinal cord, but dogs can have really bad reactions to it. So we've just got to watch her blood pressure, her heart rate, respiration, because sometimes they'll just stop breathing. So it can be a bit dicey.
Suddenly, Andrew's concerns are realised. Misty has stopped breathing and is in real trouble.
Just heart rate's just gone. Come on, Misty. We've just been injecting the contrast that sometimes dogs react to it quite badly, and her heart rate's just dropped off.
Andrew gives a shot of atropine to stimulate her heart.
Thank you. There we go, just took a breath, that's better. Normally they don't have any problems, and then suddenly her heart rate dropped to 40 and she stopped breathing, and it's like, bloody hell. She's all right.
Gonna scare us, Misty.
Yeah.
With her breathing stabilised, the CT scan can continue.
You can see here that's the normal spinal cord, and it's, you know, that's that ring of dye sitting around it, and that looks absolutely normal. And as we go back towards the tail again, we just lose that definition. She basically has got a traumatic ruptured disc. So it's just exploded up into the spinal canal and compressed the spinal cord and also whacked it pretty hard.
Misty needs surgery immediately. Andrew delivers the news to owner Rosemary and her daughter Crystal.
It's not broken, and that's good, so it's stable, but it's just the cord is, you know, probably about 60% of the diameter that it should be because it's been compressed all the way around.
Okay. It'll heal though, the spinal cord. Like
I think she's got a chance of walking again. If we do nothing with Misty, or if we delay surgery here, she probably won't ever walk again. If we do surgery, she's got a chance, and so that's what we've got to give her.
How are you?
Good. What do we have here?
Lisa has brought little bushfire victim Patricia to the Bondi Clinic to recover.
She's got burns on her feet and on her ears. They're quite bad burns, but overall she just needs a lot of care. Bye, Patricia. I'll see you soon. Thanks, Andrew. I'll talk to you.
See ya. Alrighty, Patricia. No more bushfires out here at Bondi. I'm just going to pop you into a nice cage with some flowers and a fruit salad. There you go. So the plan for Patricia now is to set her up with some food and water, give her a nice dark environment and just give her some rest. Lisa and all the vets here are going to take great care of you.
I'm interested to see what Elvis is going to be like. He goes for lawnmowers, whippersnippers. I don't think he's going to be happy when he feels this.
At the Australian Reptile Park, Tim needs to inject Elvis with a broad-spectrum antibiotic. The 5-metre saltwater croc has ripped off his toenail and is now at risk of serious infection.
So the plan is now that I'm going to lure him around and he'll actually think we're going to feed him. Come on, Elvis. I'll get him up into a perfect position where I can be side on, and then I'm going to hit him right in the back of the neck. I don't want to miss because that's what a crocodile injection looks like. It's big, and that needle head is big. It has to be to get through the skin. Everyone right, Kyle? Yep. Okay, get ready, mate. 1, 2. Got him. Got him. Whew. Okay, that was good. Right in. Bent the syringe head a bit. That's perfect. Now he's down. Got the whole lot in.
One shot should do the trick.
So that's one problem fixed. But the other is, how did he do it? There's a rubber seal within the pool. Now that's the logical spot that he's caught his toe, the body's kept going, it's caught, and the nails come off. I'm going to fix it and make sure it doesn't happen again.
It's a small job with a massive risk.
I'm going to jump in the water. He's angry, he's fired up from a big injection he just had. Should be easy.
All right, all done.
Yep. Chris has just given Jersey a blood transfusion in a bid to save the newborn alpaca's life.
I'm hoping his body is now being filled up with energy, with antibodies. He's going to be carrying so much more oxygen around. All I can do right now, though, is wait.
But now Jersey's mum also needs Chris's attention.
All right, so we need 2.5 mils for her.
An antibiotic injection should prevent any post-birth infections.
You've been very good.
She was trying.
She made her feelings very, very clear, though.
Okay, so that should be the whole family taken care of. This time where you're waiting for your treatment to take effect, minutes can seem like hours.
It's now been 20 minutes since his transfusion, and so far, Jersey has failed to respond.
Righto, we'll see how we go. If we don't do this surgery, Misty's not going to walk again. And if she can't walk again, she doesn't have a life. So we've got to do this and make it work.
At SASH, Misty's delicate spinal surgery is underway.
We're so close to the spinal cord now that one slip could mean, you know, it's all over and she'll never walk again.
The Labrador is paralysed after a fall at home. She has a badly ruptured disc and fragments are compressing the spinal cord.
So we're 0.5 millimetre away from the spinal cord. So at this point, we've just got to pull out a little bit and just start picking away with a little ice cream scoop. Now, there are risks with any surgery, but with spinal surgery, it's really high stakes stuff. I mean, her spinal cord is on the edge anyway. So if we got one wrong step here and touch the spinal cord the wrong way, we could make it so she definitely won't ever walk again. So we've got to be really careful. It doesn't look like much, but that's just a fragment of disc material that we've just rescued from within the canal. There's going to be a volume about 10 times that, which we'll eventually get out. So now I can actually see the cord. What we've done is taken all the pressure off the spinal cord and given it the best chance to heal. We're just at the end of surgery now and we're suturing everything back up. So we've done what we can, so now it's just time. And TLC.
There's a good reason you don't go swimming in here.
With Elvis's toe on the mend, Tim's drawn the short straw to fix the sharp edge that injured the monster croc.
I'm going to jump in the water. There's a seal there that just needs to be pushed in. Kyle's going to look after the croc. Lizzie's going to hold a bit of rope around my waist. And the signal is if the croc comes, tug the rope. I'm out of that water quicker than you can blink, believe me. Should be easy. Come on, Elvis.
Before Tim takes the plunge, Kyle makes sure the croc is as far away as possible.
We good over there, Kyle? So, Lizzie, if he comes, give me a yank.
There's always that chance that he can grab you, so always got to be careful. Always keep your eyes on the croc.
All right, here we go.
Guys, he's on the move a bit.
Elvis senses an intruder. Tim has to work fast.
Just that one last bit. That's it. That's good. Job's done. Elvis has got his medicine, the pool's fixed. And I tell you, there is nothing like sharing a pool with a crocodile that just wants to eat you.
Everybody standing up?
Chris has performed a blood transfusion on 3-day-old Jersey. The preemie baby has barely moved since he was born.
Come on, little buddy, come on.
Nice work.
This is just amazing.
First steps.
Well done.
Thank you. I'm relieved. He looks good.
He's never done this before. This is just amazing.
That's great. It's really good. Jersey's hopped to his feet and run straight over to his mum and suckled for the first time in his life. It's incredible.
So cute to hear him sucking.
When you meet a little guy like Jersey whose life is in turmoil, you hope that in some way you can make a difference. And seemingly today, we've done just that.
Hey Lisa, how are you?
Good. How's Patricia been?
She's doing good.
Yeah?
Yeah, we've been making some good progress.
Oh, good, good. I'll go grab her, have a look.
Lisa is at the Bondi Clinic to check up on a little bushfire victim.
She wasn't in a very good way and we were worried about infection and whether she was even going to make it. So I'm really hoping that today she's looking a lot better. Hi. How you going, Bubbler? Hey. What have you been eating? Oh, look at you. You look fantastic. She is a completely different possum. She's eating really, really well. This is a good sign. How are you doing? I know. She's definitely more feisty than she was. That's for sure. Hey?
We've noticed a lot of improvement in her ears.
Yeah.
They're not resembling crispy bacon as much as they were when she came in.
Even though they're not the most fashionable ears in town, the dead bits have fallen off and now new healthy tissue is growing and this is looking really good.
Her paws have come down a little bit.
Yeah. The tips of those toes have been burnt off and they're just starting to heal. There's some blood there, which actually means that there's blood supply and the tissue is nice and healthy. So it's going to take some time for them to return to normal, but it's definitely a huge improvement compared to how they looked. Thanks. Yummy.
We've been hand feeding her as much as possible just to stop her using those little hands.
Yeah, no, that's really good and she's eating well, which is fantastic. Next time I pop in, I am hoping to see even more of an improvement and the way she's going, I think she's going to be just fine. You're a good girl. Good girl. You're a good little thing.
Hey, Misty. Oh, it's bright, isn't it? Who's that? Is that your mum? Rosemary's come in to visit Misty today. She hasn't seen her since the surgery, so she doesn't really know what to expect.
When Rosemary and her daughter Crystal brought their paralysed Labrador Misty into SASH, they feared the worst.
Obviously, I hope that we don't have to put her down. Yeah.
It's been a traumatic ordeal for the young Labrador.
Yesterday, my daughter saw her and told me that I had to come because she was so depressed and she needed some mental health care.
I think it's really important for owners to come in and see their pets when they're in hospital because it's a really scary place for everybody, both owners and pet.
Tim Tam, which is our other dog, is really missing Misty. She's really quite depressed, isn't she? She's a bit sad you're not there, even though you pester her.
You watch Rosemary and she's patting her and giving a scratch on her tummy and Misty's sort of rolling over and taking it all. And I think it's a really nice, secure feeling for both of them. It's really important for their mental health.
Maybe if you just wander down there a bit, and we'll see if she'll wander as well. See? Look at that leg go.
Yeah, that one's going to
Yeah. Walking with Misty today, her left leg's not doing as well as the right. It's not that surprising because most of the trauma was on that side because it's still possible that one's just going to just not do anything.
Good girl. She's just a bit stuck, aren't you, darling? We just wish you could get up. That's the only problem. Yes.
Hi.
Hello, how are you?
Good. How's she going?
She's good. She's so much better. Good girl.
Lisa is back at the Bondi Clinic for a final checkup on bushfire victim Patricia. It wasn't long ago that the possum was clinging to life.
Her skin has healed very well.
Oh my goodness, look at those ears.
And she's got her spark back, so she's pretty keen to...
You want to get back out in the bush, huh?
Yeah.
There you go.
All right, sweetie.
Wow, Ali, that is just a massive improvement. They were red, raw and oozing and completely scalded, and now that's just normal tissue. So
yeah, I'm amazed how well they've healed because there was barely any skin there.
They're pretty amazing, resilient animals, aren't you, sweetness? When I met Patricia, she was this poor, helpless burn victim. And then I look at her now and she is full of beans. Her paws have healed up, her whiskers have grown back, and she's ready to climb up that tree again. Come on, Patricia, let's go.
Righto, Misty, let's see what you're up to. Come on. You're going to see what you can do.
Come on, Misty.
Oh.
It's time for Misty to go home.
Good girl. Let's see how you go. Look at that. Look at that. Oh, wow, look at that. This left one's got a little bit to go, but that's all right. She's nearly not knuckling on that other side, which is fantastic. This right side's going really well.
The operation to repair a badly ruptured disc has paid off.
I'll give her another couple of weeks and I think we'll have trouble stopping her.
Who's a happy girl?
She can pee by herself, she can poo by herself. They're the hard things. A little bit of care at home, she'll be fine, so she's right to go. Good. Come on. Come on. Hello, Misty. Who's there? They're in here. There. Oh, look out, look out. Look out. Look out. Oh, the tail. There we go. Good girl. See, they still love you.
Well, she looks thinner, which is good.
Came in paralysed and you came out thin.
Yeah.
Perfect.
Well done.
Crystal and Rosemary have still got a bit of a job ahead of them because Misty, I think, thinks she's better than she actually is. She wants to go, so they're going to have to actually slow her down. This is right. I'm fine now. It's all over. What was the worry? I'm good. And I'm skinny.
That's all you have to do.
All right then. See you later. When we first met Misty, she was paralysed in pain, and really it was touch and go because we didn't know whether she'd be able to walk again. Well, she could walk again, and that's a great result.
Come on, Patricia. Look where we are. Hello.
Lovely to meet you.
Nice to meet you as well.
This is Patricia.
This is Patricia. I'm here in Mulgoa, which is in the lower Blue Mountains, and I'm at the home of a carer called Pam. She works for Wires, and she's actually got an aviary here where Patricia's going to complete the last little bit of her rehabilitation. This is your new home. I think you're going to love it here. All I'm hearing is the piercing sound of cicadas, but that tells me we are in the bush, and that is the perfect place for Patricia to begin the next part of her rehabilitation. Go, Patricia! Come on, oh, good girl. Look at you. So lovely. That's it. Hey, good girl. I really miss Patricia. She has been a fabulous little patient, and hopefully in the not too distant future, she'll be up at the top of the tree looking down on all of us. Be in touch. Please let us know how she's going.
Do.
Thank you. Come on.
As for Jersey, the little alpaca has now fully recovered from his difficult start to life.
I didn't think Jersey would live, straight out. After 3 days of him not improving and in fact getting worse, I didn't think he had a chance. So I think what Chris did was just amazing. He's obviously saved his life and he's just gone from strength to strength. He's playing with all the others. He's just a normal cria now, which is just wonderful.
To have a chance that you've taken pay off like it has with Jersey is just one of those incredibly special things. Jersey is one of the truly unique bushfire survival stories.